Do you think you've explored all treatment options for persistent back, neck, or arm pain, but you're frustrated to find the pain and symptoms continue? Let one of our dedicated neurosurgeons explain more about our individualized approach to assessing and treating these problems and returning our patients to an active, pain-free life again.
As neurosurgeons, we operate on nerves. We operate on the whole nervous system, the brain, the spine, the peripheral nerves. We have 7 years of training where from day one we operate on spinal conditions. We're very well versed in all spinal problems. We bring the approach, the same approach that we bring to the brain, to the spine. A very careful, delicate surgical approach when somebody needs surgery that we would use on the brain is also applied to entities of the spine. Back pain is something that is many times nerve mediated. Somebody comes in and they have pain that's in their back going down their leg. It involves the nerves. Nerves are being compressed, nerves are being pinched, and such a big part of our training is to operate on nerves, to decompress nerves, to fix them so that they no longer hurt, so that they function well. And I think because of the extensive training that we have, once again, in the brain and in the spine, I think that our capability to do that type of surgery is outstanding. But being a good doctor is not just about being a surgeon and operating. It's also about taking care of people, whether they have surgical or non-surgical problems. Coastal New Hampshire Neurosurgeons, it's a very special practice. My 3 other partners have been here for quite a while. They're very old school in a very good way. They've always had a clinic where they see each of their patients. They spend a significant amount of time sitting down, talking with somebody, examining them, and they and myself, we're very interested in what somebody has wrong with them. We're very interested in helping them and taking care of them from start to finish. There is really, with maybe a few exceptions, nothing that can't be done here at Portsmouth that you would go to Boston for. And what I always tell my patients is, the nice thing about being here is we're going to be taking care of you. You're going to see us in the office. We're going to do your history and physical examination. We're going to do the operation, not a resident. We're going to see you post-operatively. We're going to take care of you. And, if you have a problem, we're going to be there to take care of it. When you come back into the clinic and have all sorts of questions, we're going to be there to answer them. When you come into our office to see us for a consultation, you're going to get a full evaluation by a board-certified neurosurgeon who's going to sit down with you, go over your records, talk to you, examine you, and look at your x-rays. And based on that, we're going to come up with a plan. Now, that may be a surgical plan, it may be a non-surgical plan, but one way or the other, we're going to come up with a comprehensive plan that's going to give you the very best chance to get back to spinal health.
The board-certified physicians of Coastal New Hampshire Neurosurgery are committed to providing the highest quality care in both the surgical and non-surgical diagnosis and treatment of disorders that affect the brain and spine. Ask your primary care doctor for a referral or call 603-433-4666 for more information today.